Now, let's talk about the baby. How is the baby developing during this first trimester? Like, what are we seeing?
So in the first trimester, obviously, we're having the fertilization of the egg and the sperm, and then we have this embryo. The embryo gets into the uterus. The uterus that's where it sits, where it will develop, form the placenta, and then develop into, neurologically, the heart will form, the brain will form, everything will start to form. And then eventually, as we get out of the first trimester, then you get the full development of the fetus.
Now, we do have to mention that unfortunately, 1 in 10 women do suffer a miscarriage during the first trimester of their pregnancy. What causes a miscarriage? And is this common? And are there ways to avoid it?
Unfortunately, there are no ways to avoid it. Sometimes most pregnancies are lost in the early trimesters due to a genetic defect that occur, an anomaly that occurs. And so unfortunately, many of those anomalies are just genetic things that we can't control. And so it's an unfortunate situation sometimes. When
you encounter a patient who unfortunately has gone through this, what are some of the things that you say to them to assure them that it doesn't necessarily mean like a dead end? Right.
And so, we always assure them that there's nothing they did wrong, because there's nothing that you can do, unfortunately. Sometimes 1 + 1 sometimes doesn't equal 2. And so, you reassure them that this is a one-time thing and that hopefully, we can get pregnant again and it won't happen again. But unfortunately, there's nothing we can do to prevent the embryo from when it starts to separate.